Assalamu alaikum everyone. I am Nafim, a student of BSc in Prosthetics and Orthotics third year, and today we will discuss about radial static forearm-based wrist hand orthosis. And for better understanding, we divided this video into three parts, where we will discuss about device, material, and the fabrication process. So without getting delay, let's start the video. A radial static forearm-based wrist hand orthosis is a rigid splint that extends from the forearm to the hand, mainly along the radial or thumb side. It is called static because it does not allow movement. The orthosis holds the wrist in a functional position, usually 20 to 30 degrees of extension, to improve hand function. And now if we talk about the indications or when we need to prescribe this device, there are many, but the most common are the radial nerve palsy, wrist drop, which is also a symptom of radial nerve palsy, post-fracture immobilization, tendon injuries, and weak wrist muscles. Radial nerve palsy is a condition where the radial nerve is damaged, leading to loss of wrist and finger extension. The most common sign is wrist drop, where the patient cannot lift the wrist upward. Because of this, the patient has difficulty in gripping objects and performing daily life activities. This orthosis helps by maintaining wrist in extension, allowing better grip through the tenodesis effect. The main material used in this device is low temperature thermoplastic such as Orfit. Mainly Orfit is the brand which manufactured this kind of materials and also known as by their brand name. It becomes soft when heated at around 60 to 70 degrees Celsius and can be molded directly on the patient's limb. It has some advantages like it is so lightweight, easy to mold and reusable, and its most common uses are hand splint, wrist and forearm orthosis, and the finger splint. Before starting the measurement process, we need to know about some landmarks, and they are the olecranon process of the ulna, the styloid process of ulna and radius, and the palmar creases. Now we can start our measurement procedure, where first we need to trace the forearm and the hand. Then we need to mark the landmarks label of olecranon process, styloid process, and the palmar crease. Then after removing the hand, we need to mark a line 5 cm distal from the olecranon label, and this will be our biggest circumference. In next step, we need to mark a line 1 cm proximally from the styloid process label, and this will be our smallest circumference. In the next step, we need to measure the biggest and smallest circumference and calculate the 2/3 of this for the area of the device. Then we need to measure the palmar crease level and take half of this. Next, we need to calculate the areas to draw the shape of the device. Then we need to identify the midpoint of our three circumferential levels, and for identifying the midpoint of the palmar crease level, we need to mark a straight line from the midpoint of styloid process level. Then we need to place our areas from that midpoint of our circumferential measurements. Then we need to connect all the points by following the anatomical shape of the hand, and just adding the points we will find the final shape of the measurement, which we use for the next process. After we got our measurement, we need to trace the shape over our orthotic material, and then we need to cut the sheet. We can do this in two methods, either with heating a knife or with jigsaw. Then we need to place the sheet into hot water of 60 to 70 degrees Celsius and wait until it becomes transparent or soft. Once it becomes soft, we will take it from the water and first place it on a cloth. Then we will directly apply it on patient's head, and in this situation we will maintain the patient's hand into 20 degree of extension to improve hand functioning. Once the sheet is hard enough and got the shape of the hand, we will remove it from the patient's hand and smooth the edges by dip into hot water again. When you are happy with your edges and they are smooth enough, we need to attach two straps around our olecranon and styloid process level circumferential areas. And this is the final look of the device after attaching the straps. And if you are still here, I hope you like the videos, and if you are interested to watch more contents like this, there are more videos related to upper limb orthosis in my description. You can check it out. Thank you.